All right, this is our DAR project from Tank 26. A little introduction to our cadaver. She was a 78-year-old Caucasian female. She was a teacher. She was an Alzheimer's patient, and her cause of death was listed as failure to thrive. Some anatomic variations. Looking at her heart, there was significant clotting. There was atherosclerotic lesions and plaque. This is a picture from one of our tissue samples showing some of the atherosclerosis that Dr. Lallier helped us find. This is not our heart, but this is showing some of the clotting that we did see in the bottom of one of the ventricles. So some possible pathologies of the heart, complications from atherosclerosis, leading to a lack of blood flow from the heart, increased blood pressure, increased stress on blood vessels, causing increased damage to the endothelial lining. As you can see in this picture, the difference between the normal and the diseased artery, clotting leading to decreased blood flow to other areas of the body. So like I just said, the damaged inner layers of the heart vessels, this could be caused by aging, smoking, diet, diabetes, lack of physical activity. Women who are over 55 have an increased risk. If she had any family history, genetics could have also led to an increased risk for this atherosclerosis. Other anatomic variations of the heart, we saw some interstitial fibrosis of the heart. In this slide, which is not our actual tissue sample, but is very nicely labeled, you can see the fibrosis between the different myofibers. This is also due to aging, accumulation of extra collagen fibers, which you can see in this picture. This leads to an increased stiffness of the ventricles, so they cannot contract as fully as they once could, leading to a decreased blood flow throughout the rest of the body. Some anatomic variations of the brain. Lack of blood flow to the right temporal lobe. We noticed it was a lot paler than the rest of the brain that had regular blood flow. This picture is actually really similar to what we saw. You can see the red blood flow over the main cerebrum and then the lack of blood flow to the left temporal lobe. Possible pathologies here could have been a possible stroke, complications from her Alzheimer's. This is showing some of the occluded blood vessels. One of the possible side effects of Alzheimer's is the occlusion of different blood vessels. Alzheimer's is actually an accumulation of the beta amyloid plaques in the brain tissue, decreases the overall brain tissue. Studies show they can also decrease the blood flow in the brain. This again is not one of our own tissue samples, but it is showing the beta amyloid plaques and how these cause a decrease in overall brain tissue. Some abnormal findings, tissues of the lungs had mild carbon deposits. She did have very low muscle tone. She did have a hysterectomy. No other significant findings in any other tissues. This is showing one of our lungs that had a little bit of carbon deposit. And this is the difference between regular muscle and some low muscle tone, which we saw a lot of. In summary, our patient showed signs of heart tissue and brain tissue complications. Effects from her Alzheimer's may not be fully known because we don't know everything about this disease yet. Cause of death was listed as a failure to thrive. There was more than one pathology we suspected. Here's our references.